and that's why you signed up for the webinar. But just really quickly, Dr. Kelly Casavale is a Senior Science Advisor for Nutrition in the Office of Analytics and Outreach for the Center for Food Safety and Applied Nutrition at the Food and Drug Administration. So a big title there. But Dr. Casavale supports cross-center and cross-departmental collaborations, particularly those related to the Dietary Guidelines for Americans, or DGAs, closer to zero, and maternal and child populations. She also supported the development of the first Dietary Patterns for children under 2 years with the 2020 DGA Advisory Committee. She contributes leadership for Closer to Zero and the FDA and EPA Fish Advice, supporting nutrition while reducing potential exposure to chemical contaminants through food. Dr. Casavale has a BS in biology from Lander University, a Ph.D. in nutrition science from the University of North Carolina at Greensboro, and is a registered dietitian. So with that, I'm going to stop sharing my screen, and Kelly, please take it away, and let me know if you need any help pulling up your presentation. So it looks like you got it. So.
Oh, yes, but it looks like I'm at the end. Let's see if I can get to the beginning.
Yeah, just your video, I think, now is all we need.
Yes, and I have to get at the beginning of the presentation. You guys are going to get to see a little bit of it in reverse here. Apologies about that. All right, and here I am. Let me get me on camera. Okay, let's see. All right, happy Thursday afternoon, everyone. It might be earlier in the day for those of you who are on the opposite coast. I just want to thank everyone for your time today, and also thank you for the invitation to come and speak to you guys today. I'm really excited to be able to present about our work for promoting nutrition for healthy growth and development while reducing exposure to children to heavy metals from foods. And the levels of heavy metals in foods really depends on a lot of factors. These include the levels of different elements that are in the air, the water, and the soil in our environment where the food grows or lives. The type of food and the amount of uptake for those kinds of foods of different elements from that environment. And also industrial manufacturing and agricultural processes have a big influence. So the FDA, where I work, has been working in this area for several decades. And in 2017, the agency created a working group. And that working group really spent time prioritizing and targeting our efforts. And so at that time, there were 4 elements identified: lead, arsenic, cadmium, and mercury. And they're identified as our priority contaminants because they have a relative toxicity that's important. They have a higher prevalence in the food supply, and they have a relative contribution from food as a source of exposure. And so we also prioritize young children because of the impacts exposure can have on their development. So you heard in my bio the mention of Closer to Zero, and I'm going to tell you more about that now. In April of last year, we released our Closer to Zero action plan, and it's a plan to reduce levels of lead, arsenic, cadmium, and mercury in foods commonly consumed by babies and young children. So although we've made great strides over the years in reducing levels, we strive to make further reductions because for these contaminants, we have no identified safe level of exposure, particularly when we're talking about development in the very young. And we know it will be very difficult, if not impossible, to get down to a point of zero exposure, but there are many steps that can be taken to get us closer to zero. And the process for uptake of nutrients in foods is similar to the uptake of contaminants from the air, water, and soil. So we really have to think holistically. Exposures to nutrients and contaminants are not happening in isolation. They're happening in combination, both in individual foods and across the combination of foods eaten over time, or what we call the dietary pattern. So foods that provide important nutrients can also be sources of contaminants, like what we're discussing today, seafood. So I'm really glad to be here today to talk about nutrition in seafood and our consumer studies and education activities at FDA to promote nutrition in our scientific work within Closer to Zero, and more specifically, our fish advice. So this audience may be familiar with the fact that seafood is the primary source in our diets of the heavy metal mercury. It's a harmful form, particularly when we're talking about methylmercury. And mercury occurs naturally in our environment and is contributed from man-made causes as well. It collects in our waters and sediments where it is then consumed by seafood. And nearly all types of fish and shellfish contain at least small amounts of methylmercury. However, it builds up in fish that eat smaller fish or types of seafood that live longer. And so we know that acute methylmercury poisoning does have clear neurological harms. However, what we're talking about today is consuming smaller amounts of mercury over time, but with a focus on the time periods of rapid child growth and development, which are the time periods of the fetus, the young baby, or the young child. And this is a time period when they're exposed to what's in seafood during pregnancy, breastfeeding, or by direct consumption of seafood in early childhood. So nutrients support growth, but contaminants like mercury can work in the opposite direction. So understanding the interplay of nutrients and contaminants can help address the impacts of exposures. We want to highlight the importance of good nutrition in Closer to Zero to help protect children from the possible harms from heavy metals like mercury found in fish. However, avoiding certain nutritious foods will likely do more harm than good. So evidence supports several potential interactions between nutrients and heavy metals. The interactions may occur for nutrients and heavy metals as they go through different processing in the body. Getting enough of some nutrients from food may help prevent heavy metals from being stored or released in the body. And they also may bind to each other. For example, the nutrient selenium in fish binds to mercury, and we are learning how important this really is. Now, the amount of body stores of nutrients a person has is also very important. Individuals without adequate body stores of nutrients can be at greater risks from exposures to heavy metals like mercury. Fortunately, the opposite is also true. Individuals with enough of the right nutrients stored in their bodies may be better able to protect themselves from the effects of contaminants. But we don't know as much as we'd like to in these areas, and importantly, on the effects of nutrients and heavy metals consumed in combination in the diet over time. We also have seen much more evidence in these interactions in pregnancy on fetal development, and less data exists for direct consumption of seafood during childhood. So communicating to health professionals and consumers about this topic and ensuring the focus is rightfully on supporting a healthy and nutritionally adequate diet is incredibly important. So as aquarium educators, I'm really glad to be able to share this information with you today. We know that consumers overestimate the risks associated with foods and underestimate the benefits. We do not want mothers or caregivers deciding that because they have heard that fish have mercury, that they're not going to feed any fish to their infants. But for child growth, eating lower mercury seafood is also important. So now I'd like to pivot and talk about our fish advice. In this advice, and you see some screenshots from our landing page here, we use fish to refer to all fin fish and shellfish. So FDA, working with the U.S. Environmental Protection Agency, or EPA, issued advice to help those who might become pregnant or are breastfeeding, as well as parents and caregivers who are feeding children, to make informed choices when it comes to the types of fish that are nutritious, but also lower in mercury. Now, in October of last year, we released updated advice that incorporated expanded information about fish from the Dietary Guidelines for Americans. Specifically, the Dietary Guidelines released in December of 2020 addressed recommendations for infants and toddlers for the first time since the 1980s. And it clearly highlights the nutrients found in fish and the relationship of these nutrients to crucial aspects of child growth and development. It also expands on the associations of seafood as part of a healthy diet on decreased risk of a number of health conditions across the general population. So this slide here shows our two infographics. We have one for pregnancy and breastfeeding on your left and one for children on your right. And these are part of our materials that are free and available for you to use, and they're available on our website. And I'm going to look at each parts of these in a little greater detail. So taking a closer look at the infographics, they explain that fish provide key nutrients such as omega-3 and omega-6 fats, iron, choline, and iodine that support a child's brain development. Choline also supports development of the baby's spinal cord, and fish provides iron and zinc to support children's immune system. Fish are also a source of other nutrients like protein, vitamin B12, vitamin D, and selenium too, which we know is important. These messages have been incredibly helpful to clarify the necessity of nutrients for which seafood can be a source as part of maternal and child diets. And the overarching message is the importance of the nutrients in fish to support child development. Now, this slide and those in the next slides also will be published for you on our professionals resources page soon in PowerPoint form. So the primary rationale, though, for the FDA EPA Fish Advice has been to provide guidance regarding how to eat fish while limiting exposure to mercury for these most vulnerable populations during the rapid stages of child development. Fortunately, many types of fish are low in mercury. FDA and EPA have created a chart to help families choose which fish to eat and how often to eat them based on their mercury levels. So our advice recommends that individuals who are pregnant or breastfeeding and children meet the Dietary Guidelines recommendations for seafood by choosing a variety of fish from what we call our best choices category, which are lower in mercury. In addition, we also provide a more focused list of choices that are even lower in mercury from within this category that can help particularly young children and women of smaller body size further limit mercury exposure while gaining the nutrition from fish. The best choices list of fish shown on this slide is one of the 3 categories of fish in FDA and EPA's chart. Now, the full chart describes best choices, good choices, and also choices to avoid based on mercury levels. And I should also note that on our webpage, we have translated this chart into many other languages. I think there's over 20. Now, we communicate also that strong evidence shows that eating fish as part of a healthy eating pattern may have heart health benefits. And this is for everyone, not just these vulnerable populations. Healthy eating patterns that include fish may have other benefits too and are associated with bone health by decreasing the risk for hip fractures, decreases in the risk of becoming overweight or obese, and even decreasing the risk for colon and rectal cancers. The FDA, EPA advice and the Dietary Guidelines recommend that those who are pregnant or breastfeeding eat between 8 and 12 ounces of fish from FDA and EPA's best choices list, with a serving size being 4 ounces or about the size of an adult palm, shown here in this infographic. Now, for children, you can introduce nutritious foods like fish to complement breast milk or infant formula in a baby's diet once they are about 6 months of age. So there's no reason to not start feeding seafood to infants. FDA recommends children eat 2 servings of fish a week from FDA and EPA's best choices list, or that list of fish even lower in mercury. For children, the amount, though, that they eat is based on average body size, which naturally increases with age. So for children, on average, a serving size is about 1 ounce, which they would eat twice a week. It increases to 4 ounces, the same amount as an adult by the time they've grown to the age of 11. So now I want to expand on some examples of our consumer studies. And I'm going to start with talking about our educational work and describing what we call our photo novels, which are developed for Chinese Americans and Hispanic Americans. And you can see those pieces in their native languages here. The goal of the photo novel approach is to use visuals, storytelling, and plain language approaches to help individuals who are pregnant, breastfeeding, and parents of young children to eat fish, but to choose types that are in our best choices category. Here are some snapshots from our photo novels. And the key messages are that the nutritional benefits of eating fish are many, how to choose fish low in mercury by using the chart, how much and how often to eat fish, as well as ideas for healthy ways to cook fish. They tell a story of a couple who have found out they're having a baby. They reach out to their family with joy and to begin to decide what to do next. They visit their doctor where they learn about eating fish, take that information home, and with the support of their families, prepare healthy and lower mercury, culturally appropriate dishes. So our illustration style and the stories were culturally tailored to customs and traditions related to pregnancy, post-pregnancy, foods, and family life. And we incorporated these aspects into the dishes used in the stories and the settings, as well as the characters. Now, we conducted consumer testing prior to finalizing these pieces with interviews of 18 bilingual participants, with most participants eating fish 2 or more times a month. We assessed if main messages were clear and the information was perceived to be useful, and to gauge intention to use the EPA FDA Fish Advice chart and to actually eat more fish or feed more fish to their children. Now, this slide shows some of our findings. They were generally positive responses, with some of the participants' comments shared here. Now, we were really pleased that we not only were sharing information they found useful, but participants could identify with the characters and stories as relevant to their culture. Most importantly, some participants indicated the photo novel could help them eat more fish. So moving on, I also want to share that we have a social media toolkit. All of this is also free and available online, as are the photo novels and the infographics I showed you. The social media toolkit is also available in Spanish. And as you can see on this slide, we have graphics, tweets, the infographics that I mentioned, our web badges, and content that you can use in a newsletter or other outreach of your own. And so we hope that you're able to utilize some of these pieces with the populations you work with. Now, as we move forward, we have several new projects planned. And I want to tell you a little bit more about that before we get to have some discussion and I answer your questions. So soon we are going to launch a study of the scientific evidence on nutrition and toxicology of seafood on child growth and development. And this new work will help us even further understand these interactions of nutrients and mercury, as well as other contaminants in fish, and the overall impact of consuming different types of fish and what they may have on supporting child growth. Now, in these areas of consumer studies and educational messages, we aim to be very scientifically based in our consumer messaging, as we know that consumers are likely to overestimate the risks and underestimate the benefits of consuming seafood. And that we will always have some level of contaminants in seafood, but it's very unique in its contributions in a healthy diet. So in addition, this fall, we will be conducting a series of focus groups to better understand parents' awareness and understanding of concerns around heavy metals in the foods their families eat. We aim to learn more about what and how to communicate to families on these issues in ways to support them in feeding nutritionally adequate diets to their families. These findings will also inform the development of consumer messaging, content, tone, and flow of information, and the look and feel of the content on fda.gov. We also will use various tactics for broad dissemination of our messages and resources. We also are in the early stages of developing a project plan to do similar work with professionals who are dealing with these issues in their profession or with the populations they serve. We hope to conduct target audience analysis and develop a strategic plan to implement our consumer education on this topic. We know that our target audience will include various segments: parents and caregivers of babies and young children, healthcare providers such as pediatricians, nurse practitioners, physician's assistants, and educators such as yourselves, as well as other educators such as those in the Women, Infants, and Children program, community health educators, and a broader group of stakeholders such as professional organizations and others from academia. And so we're going to strive to develop our tailored educational messages that really can be used by you and all of our target groups. So for our fish advice specifically, plans are underway to conduct a consumer study on the effectiveness of our advice in helping individuals choose more fish lower in mercury, and hopefully to identify strategies and tools that are new that could scale up those opportunities in our general population. We're working in a number of areas for the future of the fish advice, including identifying populations for which additional tailored guidance may benefit health, such as American Indian and Alaskan Native populations, and any population for which data are available to identify communities for which their seafood intake might vary substantially from our national data. We're working with our federal sister agencies such as EPA, USDA, CDC, NIH, and others to coordinate our efforts in these areas as well. So I want to close today with a bottom line takeaway for you. Data are really clear that most people need to eat more seafood, and doing so is necessary to support adequate nutrition, particularly those needed during periods of rapid growth like pregnancy and childhood, but also to modulate the effects that heavy metals can have. But everyone could benefit from the nutrition seafood provides. Our nutrition messages need to support these goals. So I want to thank you for your attention today. I hope you will be able to take this information and the resources and use them in your work. And as we move into the question and answer portion of today's talk, I also want to note that I'm interested in hearing from you today. I'd like to know more about what information and resources you would use with your patrons in your communities. And if you're not able to share today, I've included my email address on this slide, so please reach out anytime. And with that, I'll pause and see if we have any specific questions yet.
Thank you so much, Kelly. That was really interesting. And I also would be really curious in what people have to say about how they might want to incorporate this information into their exhibits or programs. I have some questions myself, but I'll start with Amalia, who has a question in the chat. I'll just read it out for you. So she said there are a lot of omega-3 enriched products these days, like milk. She's curious if it becomes more confusing or helpful to talk with people about why consuming marine-derived omega-3s is particularly important.
Yeah, that's a great question. And I think one of the things that's really important when talking about nutrition and seafood is talking about the full package of nutrients that are provided by fish. It's very unique in many, many ways. The nutrition package that it provides is not just omega-3s. You get the omega-6s, you get choline, you get selenium, you get vitamin D, you get iron, you get iodine. I mean, the list goes on, B12. So the list just goes on. And so there really is a package of nutrition in fish that's very unique. And there have been systematic reviews that were done specifically on omega-3 fatty acids by the Agency for Healthcare Research, AHRQ, and specifically looking at their role in child growth and development, similar to the studies that are done on seafood. And in their systematic review of the literature, they weren't able to find a significant connection between those omega fatty acids and those outcomes. And that was very surprising. And so that tells us that it's more than just that. We know omega fatty acids are incredibly important in child brain development, but these other nutrients in fish have an important role as well. And so it's really the combination of these nutrients together that really has a benefit for child growth and development. I would also say for the general population that, of course, you could take a supplement of omega fatty acids, but eating seafood as one of your main dishes has a lot of benefits. One of the associations I described that the Dietary Guidelines evidence base has found is the association of fish as part of a healthy eating pattern and reduced risk of overweight or obesity. And a lot of that has to do with the way we prepare and eat fish and the combinations of foods that we eat it with. They tend to be lower in calories overall. Even when they're fried, they're often lower in calories than an alternative, such as a hamburger or a steak. They have less saturated fat and a healthier proportion of fats and all of these other nutrients that are available. So there's a lot of reasons why we would choose seafood over a supplement or even over some other healthy options. And working more seafood into a healthy dietary pattern really can bring forward these health benefits.
Thank you. We have someone else typing in the chat, but while he's typing, I'm just going to ask a question here. In your kind of idealized vision, what would an exhibit look like for you in an aquarium or a nonprofit that would really communicate this to the public in the best way? And like, what's your ideal exhibit there?
Yeah, I think that's a really interesting idea. I have an aquarium where I live. I'm in Charleston, South Carolina. And when I go into the aquarium and I see the big atrium, which not all aquariums have, these giant atriums, but whenever I see exhibits in aquariums or in other community centers and things, I think about how engaging and the interaction between children and families in those environments. And I've been learning about fish and the topics related to mercury over time. My work with becoming an expert in this area was because when we were writing the 2010 Dietary Guidelines, which was the first dietary guidelines for which there was a general recommendation for amount of fish for the general population related to heart health, I was assigned to that topic. And so I became an expert in the area because it was assigned to me as part of my job. And, I would think about it a lot then and, think about, well, what would make me really understand these issues? And when you go into an aquarium, often you have those really big, deep, long tanks where you can see the large fish. And I think understanding the ecosystem and the ecology that goes into why fish are different sizes, predatory fish versus non-predatory fish, freshwater fish versus ocean fish, all of these different aspects of fish that can contribute to their composition is a big part of their nutrition and their contaminant structure as well. So for me personally, I think it was really interesting when it finally, you all work in aquariums, so you probably didn't have this aha moment the way I did, but when I realized that, mercury bioaccumulates because big fish eat small fish. And so it's additive. As big fish eat small fish, the mercury builds up. And as fish grow to be older and really large, the mercury builds up. Well, in an aquarium, you can see that with your own eyes. So you can, you would be able to look at an aquarium tank and say, which fish do you think have more mercury or less mercury? And, why do you think that is? And then to really work through, well, what are all the benefits of fish? Which ones do we eat? Which ones do we not eat? And why? And really understanding what those nutrients do in growth and development. So similarly, I could really see an exhibit walking through child growth and development and really teaching about how our brains need to grow and how we need nutrients to help our brains grow. And that there's this interaction between nutrients and environmental chemicals that they will always be there, but that doesn't mean the food is not healthy for you. We just have to make wise choices to make sure we're getting enough of the nutrients and not too much of the contaminants. So, that's kind of what I see, is that you would come in an atrium and have these visual displays that are about child growth and development, but are also about the life cycle of fish and connecting those together to talk about mercury and the nutrients in fish in a way that it gives families information that's tangible about why they would choose more fish.
Thank you. That would be an amazing exhibit. Michael has put his question in the chat now. So he asked, what is the second most harmful contaminant you can think of that may be present in seafood? Just for some context.
There's several other contaminants that we've been tracking in seafood. The difference is whether or not you're talking about a chemical contaminant or like a bacterial or toxin. So I think with seafood, one of the biggest risks is consuming raw or undercooked seafood and the issue with bacterial contamination or the toxins that bacteria may give off. But when it comes to environmental chemicals, I think persistent organic pollutants have had a body of evidence growing over the last couple of decades. And we do have some data at FDA that's starting to look at PFAS. And so, those are some that we also see. So I want to mention this study that we're embarking on to take a look at the scientific literature around nutrition and toxicology in seafood and child growth and development, because that scientific endeavor will look at all nutrients and all potential chemical contaminants in seafood. So this will really be an opportunity for us to step back and say, we know that there's a plethora of literature on mercury, but where else is there adequate emerging data? Because we do look at risk-risk trade-offs. And so when we're trying to provide dietary guidance that helps someone make a choice that's going to support their health, we want to make sure that the behavior that they may switch to doesn't come with just different risks. And so I think that's definitely something that we're looking at and monitoring in seafood. So thanks for that question.
Yeah, thanks. And just, he noted that locals in his community are concerned with pharmaceuticals in a fillet or runoff from a water body. So just kind of, getting that information out there about those other potential contaminants.
Thank you.
Yeah. And so Kirsten asked, she apologizes if you already addressed this, if her connection was breaking in the beginning, but you mentioned something about the interplay between selenium, sorry if I mispronounced that, and mercury. They have a lot of stakeholders who have been telling people to ignore mercury advisories because it is negated by selenium. Do you have some good talking points to address this?
Yes, I think my talking points are that the jury is still out. We know that there is a relationship between mercury and selenium. Selenium has a high affinity for mercury. I was just in a meeting earlier today where we were talking about this issue specifically. And I think, again, the scientific review that I mentioned that we're getting ready to embark on, it's going to be independent scientific review done by a third party. And NOAA is one of our collaborators on it, as is EPA and USDA. We'll be looking at that specifically. We're asking them to look at the mechanisms of action of the interplay between nutrients and environmental contaminants like mercury and any others. So we know that selenium has a high affinity for mercury, but the evidence is really mixed as far as, we can't say that it's a 1-for-1 molar relationship, that for whenever, for one part of selenium that you have an equal part of mercury that they're going to cancel each other out. We can't say that for certain. And we don't know what that relationship specifically is going to be and if there's other actions at play. So I think that it's a very hot topic in this area of evaluation. Even our Codex Alimentarius, which is our international food standards, are considering selenium when they talk about what the limits for mercury can be in fish. So I definitely know that it's a topic for you all to continue to watch. And when we start our scientific study, I would definitely share the information so that it can come out for this group. And as that work concludes, it's going to be an 18-month study. I'm happy to come back and give a presentation on those findings at that time. So it's definitely a good question. I don't have the answer yet.
Thank you, Kelly. So a couple more people typing. I'll ask a really quick question, or Kristen says thank you. So if someone had a question about like environmental issues with seafood, or we're concerned about, I've heard people say, oh, farmed fish isn't as healthy as wild salmon or something, what would your messaging be to kind of, when you're talking about mercury, and then people also have questions about the environmental concerns they have, whether they're real or not, how would you kind of like combine these concerns or in talking points?
Yeah, I think there's a lot of areas to consider. We are working towards a plan to update our fish composition data. It's going to take several years to do that. We do have a substantial amount of fish composition data, both nutrient data and methylmercury data and total mercury data, but it's been collected over a number of decades. And so we do want to update those data, because a lot of things have changed in wild caught versus farmed practices. A lot of things have changed in our waters as far as what is in the environments where fish are growing and living. And so I think right now it's hard to say that there's any fast and true approach. We could say what our current data tell us. But I think once we have updated data, it'll be a lot easier to be able to address some of these questions. Those data that we currently have are available. You can go into what's called Food Data Central. It's a database that is maintained by the USDA Agricultural Research Service. In Food Data Central, you can search wild versus farmed versions, and you can see what the differences are in the nutritional profiles. Now, they don't have the chemical contaminants there, but they do have the nutritional profiles, and so you can see if those are different. You can also see when those data were collected and how many samples there were. So you can see whether or not it was 3 samples from 1975 or if it was 80 samples from 2014. So I think there's a lot of information that's out there, and I'm interested to know which of those issues you guys hear the most. that you think consumers are most interested in that would help them make choices about which seafood they eat, but particularly to eat seafood, period? Do you, if you find that there are barriers or concerns that your communities have around eating fish that creates a barrier and they just decide not to eat it because they don't know the answer, that would be really valuable for us because we can do consumer studies to delve deeper into those topics and to develop materials that answer and provide that information for those communities.
Yeah, thank you. Well, if anyone has the answer to that, you feel free to put what you've experienced in the chat, and Kelly can take a look at that or reach out to her. And Michael just followed up wanted to let you know that during their next invasive freshwater fish roundup, they're going to quantify mercury content. And they would love to make a program regarding readily accessible invasive seafood to underprivileged communities. So there's some research that shows the invasive have lower amounts than even native species. So that would be cool if the FDA worked on that as well to kind of look at that. I don't know if you have any comment about, invasive species versus native or.
Yeah, no, I don't have many comments on that, but because, when it gets down to the species, that's out of my ballpark more so. It's in our office, our division of seafood safety. But I want to mention too that we work really closely with EPA, the Environmental Protection Agency, and they cover the gathering of most of the data and working with states around recreational fishing, whereas FDA covers most of that information around commercial fish. And so we collaborate, and right now our fish advice is very much focused on commercial fish. But I'd like to see it move towards making sure that we're covering recreational fish adequately, because I think that's where a lot of the community concerns lie. And so we are interested in looking at issues related to health equity to make sure that the advice we're providing is applicable in specific communities, particularly those that may rely more heavily on sustenance fishing, recreational fishing for their food source. For a number of different reasons. And so I'm really interested to connect with those of you who may have interests or expertise in that area as we move forward. So please do reach out to me by email.
Yeah, thank you. I know in the DC area, a lot of subsistence fisheries in the Anacostia and Potomac. I know there's a lot of work there. Just want to see if anyone else has questions or comments for Kelly. I'll give us a few seconds here for anyone else to type in the chat.
And before you close out, I just want to mention that to find all of our materials, all you have to do is search FDA Fish Advice, and the link that will come up will be to our main webpage. And if you scroll to the bottom, you'll see all of the resources I described today. We also have a Q&A webpage that will answer a lot of common questions. And then we have a technical information page that provides all of the raw data and the means and all of the references to all of the data that we use to underpin and do the calculations that created our advice and the updates to our advice. So if you're interested in accessing this information, having it readily available, it is pretty easy to find. And you're always welcome to email me and ask me questions anytime.
Well, thank you so much. I think I don't see anyone else typing in the chat, but I think it's a great resource. I would love to see more of this incorporated into aquariums and exhibits along with all the other messages. So I think it's super important and a great way to engage people who maybe wouldn't otherwise be interested in the topic of seafood and aquaculture and things like that. So yeah, please do be in touch with Kelly if any of you would like to follow up. And again, we'll post the recording soon, so you'll be getting that. So please share it out. And hopefully we'll have another webinar in a few months. And so we'll let you all know what the next one is. With that, we'll close today's webinar. And thank you again, Kelly. That was really wonderful.
Thank you for having me.
Yeah. All right. Well, thanks, everyone. Have a